About 10 or 12 years ago, I became sick, and therefore that's when the depression set in. So eventually I lost one long-term job. There was no understanding, there was no comprehension of mental health and issues and what can we do to help you through this. And I feel I was a competent employee, but my health was in the way.
ConocoPhillips believes in the importance of mental health and overall well-being for our people. This year's campaign was to raise awareness and to chip away at stigma. And I believe with the participation that we had in our programs this year and the initiatives specific to the mental health campaign, we were successful in achieving those goals, raising the awareness, getting people to talk about mental health, and that was huge for us. Mental health issues and talking about mental health issues is something that people are not really comfortable doing yet.
I joined the military in 1990, straight out of high school. And then shortly after joining, I went to Croatia, where I suffered my psychological injury. From there, we were immediately sent back into our workplace. There was no mental health support. So I spent about 9 years with many problems, some personal issues, some addictions issues, some marital breakdowns. Eventually, I found a program called the Operational Stress Injury Social Support. I was diagnosed with post-traumatic stress disorder, and then I was able to get help.
At the City of Calgary, we first introduced the mental health strategy as a project. We did a lot of work to really draw attention to the issue of mental health. Good mental health in the workplace means high employee morale, it means increased productivity, and then eventually it means good service to the citizens of Calgary. Over the years, we've done a lot of work around the physical components of well-being as well as the social aspects of health and well-being. And so we did see that there was a gap there. And so it was an opportunity for us to start addressing that gap.
For me, mental health support and mental health initiatives are extremely important to have in the workplace, because when my mental health is in check and when I'm feeling healthy, I'm better able to support my clients and my peers.
And so without support, you're just kind of alone, and you're out there wondering, what am I going to do next, or am I even going to be around? How am I going to cope?
I would certainly encourage other employers to embrace this concept and to put the effort in place that's required in order to introduce a mental health strategy in the workplace.
And I think we as employers have such a great opportunity to help people. When we see someone struggling, we know that something's not right, they're not themselves, and we need to be able to say, how can I help you? I can't fix it, but how can I help you?